Thank you, Mr. President. So every year in October, we recognize Breast Cancer Awareness Month. We know that in the United States, each year, more than 268,000 women and approximately 2,600 men are diagnosed with breast cancer. 1 in 8, or 12% of women, will develop breast cancer at some point in her life, making breast cancer the most common cancer among women, except for skin cancer. Every year, we make sure that we highlight these statistics and we encourage everyone to seek preventive care. I think this year in particular, it's even more important to highlight this very critical issue given COVID-19 and what many doctors, many medical practices have been warning that a lot of people have put off a lot of these types of preventative tests like mammograms because of fears of COVID-19. But it is so important that everybody remember that you must make sure to pursue these types of preventive measures. As I've shared, every year our family was touched by breast cancer in 2002 when my younger sister was diagnosed. She, battled this disease with extreme courage, but at age 39, she passed away from complications of this disease. And it is so important to highlight the work of many in our community to support and to educate and to provide the kind of preventive services as well as supports for anyone who is going through this terrible situation. We'll read the proclamation and then I will ask our guests who will be receiving the proclamation. We have today Dr. Christopher Rogers, Policy and Strategy Officer, Healthcare for the Uninsured, Health Promotion and Prevention Services from HHS, as well as Ms. Takia Pearson, Administrator, Health Promotion and Prevention Services, and from Nueva Vida, Ms. Astrid Jimenez, Executive Director of Buena Vida. This is an organization that provides support primarily to Latino women who are going through this disease. My sister happened to participate in some of their support services and programs, and I was able to see firsthand how important this organization, how critical their services are to the growing number of Latino women in the region. So let me read the proclamation. Whereas October is National Breast Cancer Awareness Month, and since the public education campaign began in 1985, there has been a gradual reduction in breast cancer in women aged 50 and older, and death rates have declined since 1990 due to better screening, early detection, increased awareness, and continually improving treatment options. And whereas in the United States each year, more than 268,000 women and approximately 2,600 men are diagnosed with breast cancer. 1 in 8, or 12% of women, will develop breast cancer at some point in her life, making breast cancer the most common cancer among women except for skin cancer. And whereas the COVID-19 pandemic has highlighted the disparities in access to needed medical treatment faced by communities of color nationwide, and has highlighted the need for equitable access to treatment for diseases, including breast cancer. And whereas since 1999, Nueva Vida has provided free, culturally sensitive, bilingual support services to members of the Greater Washington region's Latin American community who are most at risk for developing breast cancer, as well as providing support and counseling for their families. And whereas the Montgomery County Department of Health and Human Services offers screening exam voucher programs for uninsured county residents with incomes at or below 250% of the federal poverty guidelines to ensure that vulnerable residents are able to access vital healthcare services regardless of income levels. And whereas this month, we stand with the mothers, daughters, sisters, aunts, and friends who have been affected by breast cancer, and we recognize the ongoing efforts of dedicated advocates, researchers, and healthcare providers who strive each day to defeat this terrible disease. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland, hereby recognizes October 2020 as Breast Cancer Awareness Month in Montgomery County, and recognizes the contributions of all those who help prevent, detect, and treat cancer, and who work towards a future free from cancer in all forms. And that is signed by Council President Sidney Katz and myself on today, October 27th. So let me ask our guests to make some brief remarks and talk a little bit about the work they do and just some advice. So let's see, who is here that could start? Okay, I think I have, yes. Dr. Christopher, yes, go ahead.
Good morning. Thank you, Councilman Navarro, for involving Montgomery County's Public Health Services in Proclamation. I've been touched personally by this issue. As you mentioned, Councilmember Navarro, breast cancer is the second most common type of cancer in women living in the U.S. The incidence rate of female breast cancer in Montgomery County has fluctuated over time, although our most recent data from 2016 has shown a significant decrease in the age-adjusted incidence rates. The breast cancer mortality rate in the county followed the decreasing trends seen in Maryland and the U.S. The county rate was consistently lower than in Maryland and the U.S. In Montgomery County, minorities continue to be disproportionately impacted by breast cancer, with non-Hispanic Blacks having higher mortality than non-Hispanic whites. Breast cancer significantly, as you mentioned, impacts Latino women. Now, breast cancer is largely controllable through prevention, early detection, and treatment. And to continue to see these declines in incidence and mortality rates, public awareness is essential, as County Council is doing today. And robust investment of prevention, detection, and treatment resources is important to ensure that breast cancer screening services and high-quality treatment are available and accessible, particularly to medically underserved populations. Public Health Services is thankful to Councilmember Navarro and the entire County Council for this proclamation recognizing Breast Cancer Awareness Month. I'll now turn it over to Takia, Health Promotion Manager, to share briefly about a county breast cancer prevention program that's helping to improve health outcomes for Montgomery County's most vulnerable residents.
Thank you. Good morning. So the Montgomery County Women's Cancer Control Program has been funded by the Centers for Disease Control and the Maryland Department of Health for over 30 years. The program exists, and its goal is to provide free breast and cervical cancer screening to detect cancer at its earliest and most treatable point. Since the program's existence over 30 years, we've screened over 11,000 women, and we continue to provide these services during the COVID-19 pandemic. So we appreciate your acknowledgement, your support, and we look forward to working with you and our other community partners, collaborators, and providers to continue to provide these services to the women in the community who are most at need.
Thank you so much. Let's see, is Ms. Astrid Jimenez here? I see her name on the screen, yes.
Yes.
Yes, Ms. Jimenez. I don't know if can the video be enabled? Good morning, go ahead.
Good morning.
Good morning.
My name is Astrid Jimenez, Executive Director of Nueva Vida, a support health network for Latinas with or at high risk of having cancer. 21 years ago, 3 courageous Latina breast cancer survivors incorporated in Maryland with a mission to inform, support, and empower Latinas whose lives were affected by cancer, and to advocate for and facilitate the timely access to state-of-the-art cancer care. Today, I want to congratulate the Council for their commitment to ending breast cancer, especially in underserved communities, by funding early detection campaigns and providing services to those who have been diagnosed with such cancer. You have established partnerships with community-based organizations like Nueva Vida, enabling us to work with you in ensuring that an often invisible and very vulnerable population receives the proper medical attention when they hear the words, "you have breast cancer." Your legislative actions demonstrate that for you, Breast Cancer Awareness Month is more than a pink campaign, and that your October proclamation is actually a celebration of your partnership with organizations, as well as a recognition of the challenges ahead. Nueva Vida values and respects its relationship with Montgomery County and with the council. And as advocate for Latinas, we must say our work is not over or done. Supported by a Montgomery County grant this past weekend, we held a 2-day breast cancer awareness event in Wheaton Mall. I must confess that part of me was discouraged because the questions and the conversations I had with the community still reflected a profound unfamiliarity with breast cancer. However, part of me was grateful because your grant is allowing Nueva Vida to educate women about a disease that will affect many Latinas and claim their lives. And thank you, Councilwoman Navarro, for sending your staff to Wheaton Mall to see us in action. This morning, I want to leave you with words of gratitude for our partnership, the services that you provide to the Latina community, and with a call to continue funding outreach and breast health education in an effort to improve early detection, because early detection actually prevents deaths. Lastly, again, thank you again for the invitation to address you and for the recognition you're giving breast cancer and Nueva Vida's work.
Thank you so much. Thank you for all that you do. Thank you, Mr. President.